Okay, so what we're going to do here is something I've termed in the office called flossing. It's actually not termed by myself, but it's used for if you have any type of nerve root radiating symptoms. So we're going to start with low back radiating symptoms, so that can range from things like sciatica to lumbar herniations, bulging that's causing pressure and stress going down the nerve root into your leg. So you're going to be seated for this, very simple exercises. Your leg's going to come out in front of you. So I'm actually going to show you from the side here. Okay, you either want your back supported here against something flat where you're sitting up nice and tall. Don't want to be hunching, don't want to be lounging back here. Okay, so you're up nice and tall. I like sitting out from the edge of my chair a little bit, having a little bit of space. Engage your core, tighten up your stomach. Okay, you're going to lift your leg. This is the leg that is effective, that is having the radiating symptoms down, whether that's sciatica or elsewhere. Take your leg out in front. Okay, I'm looking straight forward right now. My toe is going to be pulling back towards my chest. If you need a little extra support because of pain, you can also grab behind your leg to add a little bit extra support there. Or again, you can sit back on your chair a little bit just to add a little bit of extra support underneath your leg. Okay? So I'm here, my toe's going to pull towards my chest. Should feel a little bit of a pull, maybe a slight increase of pain or symptoms. Slight is okay, major is not. So if you have major increase of symptoms, stop, check with me before you go and do this any further. Okay? You're here pulling your toe towards your chest, and you're going to look up to the ceiling with your head. Hold for about 2 seconds, and then you're going to bring your chin towards your chest, and you're going to point your toe away from yourself, down to the floor. Okay, chin or toe towards your chest, look up, toe down towards the floor, look down. Okay? Very simple stretching exercise. Can you do this standing? Yes. I would recommend you have some support while you're doing it. Your leg wouldn't obviously be out at this degree, be out more of an angle, but I would prefer you seated if at all possible for this type of flossing exercise. Okay? Now, we also have other nerves throughout the body. We have nerves coming out from our neck, from our spine, because guess what? Your spine is your nervous system, and it controls everything in your body, sending messages out from your brain. It's the beauty about chiropractic. So, what we're doing here, let's say you have some radiating symptoms out from your neck, or maybe you're having some radiating symptoms down your arm. That could be caused from your neck. It could be caused from things like pronator terres syndrome, carpal tunnel. That's a hot word that's thrown out there a lot of times. A lot of times carpal tunnel is actually entrapment elsewhere in the arm or in the neck. Okay? So what we're doing with this is you're going to put your hand down to the floor like this. Okay? Now preferably if you have a wall to push up against here, I prefer that. If you don't though, such as when you're at work, you can just put your hand down as much as you can, okay? Sitting up nice and tall, I'm going to look towards my hand, okay? I'm going to do a little semicircle away and down to the floor. And I'm going to do a nice slow semicircle back to the hand. Might do that 5 to 10 repetitions, okay? You'll feel a nice pull and stretch, and if you do truly have what's called a radicular symptom, that might also slightly increase. Just as I mentioned with the lower pain radicular symptoms, if that increases too much or your symptoms get worse, stop, check with me before you kind of move on from there, okay? So that's the first position. Second position, you're gonna flip the back of your hand either against that wall or just out away from you with your fingertips pointing down to the floor this time. Doing the same type of thing. You're gonna be looking towards your wrist, towards the wall, semicircle up and away, down to the floor, up and back towards your wrist and wall. Again, for a series of about 5 to 10 repetitions, 2 to 3 sets. Reason I have you turning your hand in different positions, and you can play around with that. Well, nerves go everywhere. There's multiple nerves, they're not just one, so we have to work the nerve in various different ways, okay? One other thing I'm going to go through here, and I'm actually going to get on the stepper right behind me, is this is common in runners, okay, and I give this to my runners a lot. I'm sure we can all relate, if you're a runner, to having some type of pain, potentially starting at your knee, going down the side into your ankle joint. Yes, it might be somewhat shin splint related, or it could also be something called your peroneal nerve. So your peroneal nerve runs in that same location. It could be actually causing or contributing to your shin splints, your ankle issues, your foot issues, your knee issues, or it could be a separate issue. Regardless, this is going to help stretch out the muscle associated with shin splints, but it's also going to help glide that nerve in that same area. So I'm going to step back here on the stepper here. What you're going to do here, this one you're going to be lying down for, okay? And I'm going to show you from this side here. So if you're lying down here, okay, you're going to have a bent knee. If you look at my ankle and my foot, we're going to point your toe away from your body. So I'm going away from me here with my toe, okay? From there, I'm going to straighten my leg up and then bend it, bring it down all the way to the floor or the table, wherever you're lying, and then straighten out my foot. I'm going to reverse back here, pointing my toe away again, bending my knee up, keeping my toe away, straightening my leg up, coming back to that bent 90-degree angle, straighten my toe up to the ceiling. I'm going to go through that one again. Toes, my knees 90 degrees. I can add support with my hands if need be. Point my toe away, go up to the ceiling, bend my knee, come down to the floor. Straighten out my toe to the ceiling. Toe goes over away from me, bend my knee, come up to the ceiling, straighten, come back down to that 90 degree, straighten out my toe, okay? And that's, as I mentioned, very good for running. Reason it's called flossing, if you imagine or envision a nerve going all which way out from your spinal cord, that nerve can get entrapped in areas of the joint, which we work very well with chiropractically, but it also can get entrapped by scar tissue, muscle that's tight or in spasm. This helps breaks up that scar tissue and glide that nerve a little bit easier so that when we go do activities such as running or walking, we don't have the pain that we potentially would have as a result.